I warmly welcome Dr. Rameshwar S., Deputy Director of Center for Environment and Occupational Climate Change, Health from National Center for Disease Control, Ministry of Health and Family Welfare, Government of India. Today, he will deliver his lecture on climate change and health implications. It is 30th lecture of recorded webinar on water for public health, preparing disaster and pandemics, presented by National Institute of Hydrology under aegis of Indian National Committee of Intergovernmental Hydrological Program of UNESCO. Over to you, Dr. Rameshwar. Thank you.
Thank you very much, Varun Goyal. It's indeed an opportunity, to express about the program, in every platform for the country. This we believe that, with these mechanisms, with this way of, these expressions or presentation from our side, we may be able to, give our informations regarding about the program on climate change and human health, and that is the National Program on Climate Change and Human Health, which has been, recently in the last 2 years, last 2-3 years has been working very hard. So we are from the National Program for Climate Change and Human Health. I'm Dr. Rameshwar here from, National Center for Disease Control, and this has been, monitored by the Ministry of Health and Family Welfare. So the presentation would be somewhere like, what is this climate change and what will, this climate change will impact to the, to the people, and what we are doing at the present moment, is for the country, for the citizens of the country, So, and how this national program will address the health impact of the climate change in the health sector, and about a brief background on its key objectives and the various others, that initiatives that has been undertaken under the program. This will be, and obviously the last one will be the way forward about its partnerships with other ministries as well as with other, departments. That is where the, the whole program will, look forward. We all know that this climate change is a global phenomenon, and this is what we saw, what we are visuals now about the climate change are in the form of these temperatures. These are rising. There are reports, there are evidence, that has been coming up. That the number of in the cities, the number of areas, these which are having, the higher temperatures, these are increasing in the across the country, including the, in Indian states, including the, the regions in the country, and the sea levels are rising. There are many, these countries or the regions or islands now, where, there is a fear that the sea levels are rising. So the, the lands out there will be, this perish or will be under the sea. This is what has been, the constant fear and constant, predictions that has been coming up. And even the Indian coastal regions, coastal states in the western and eastern sides, there has been, issues on these areas. About the altered rainfall patterns in the form of that some of the, these regions are experiencing heavy rainfalls. In terms of the amount or in terms of the number of days. So many of the cities, they are experiencing this flash floods. In the recent times, we have, this the state of Kerala has been experiencing, these heavy rainfalls. Not only that, the Indian cities of this Bhopal and the states of this Andhra Pradesh, this this Tamil Nadu and all, Chennai. These are all, reporting, the higher, this impact of this rainfall. So these are being seen, and in some areas, droughts are more seen. In some areas, heavy rainfalls are seen. So the patterns are either, more heavy, or others, it's scanty in this, rainfall pattern. So impacting the ecosystem at the same time is impacting the health of the people. The others are these extreme weather events. When you say extreme weather events, these are, the floods or these are more of the, when we say the extreme weather events, in terms of this climate change, these are more of the hydrological in nature, and these are more of the heavy rainfall, floods, cyclones, and opposite to that, these are drought, these are more seen, so these are the ones which can impact, directly to the health of the people, where, these are the incidents now, these are the acute weather events which can cause, disasters. And in disaster, during disaster, as we all know, that there are, increasing number of deaths now. At the same time, there can be injuries, and at the same time, there can be displacement of people, where, we'll find this mental, issues. The fifth point is about ocean acidification. These are another concerns, that, with the climate change, the ocean acidification is a very, important area, which leads to, this the organisms, the change in the organisms in the oceans. So the, the natural behaviors, the natural environment, these are lost, and the types of these, these organisms, the fish, the plants, these are changed, these are either, impacted. So last, that we usually say is the climate active, this pollutants, which absorbs this, which can absorb the radiations, and can further increase the global warming. These are some of the visibles, that we are, finding, with climate change. And when we say climate change, it means that, it's a long-term impact in the weather patterns, and that is, experiencing by reason, by the people of that area. And so in the next, the, that I would like to say is that, the consequence of overall consequence, as we say in the initial part, is that, see, as we can see here in the slide, that all the, land, air, this water, these are impacted. All the forms of this, all the, this three forms of this art, this can be impacted. So whatever is there across this, all the living organisms in these areas, this can be affected. And one or two, this more another important part is the air pollution now, which is very much, badly impacted due to climate change now. And this air pollution, as we all know, that is, it has the same, origins for impacting the climate change, like that, like, so air pollution is another area which has, which everybody, has to breathe. And, a small change in the air pollution, and this can impact, the whole population, about 7 billion population across the world. So, the climate change overall, what we denote is about the, global warming. Till now, what we have, said is that, it's about 1.2 degrees Celsius rise in the temperatures, at the present moment, and we are trying to limit it to 1.5 degrees Celsius, if it is more preferable. Beyond this, and if it reaches to 2 degrees Celsius, and that it will become, something more of a critical, very critical state, in which it may not be able to return to the, this normal, normal way of life. So there has been a lot of these campaigns. There has been a lot of this international, organizations, international communities, United Nations, this countries, which has been part of this, this campaign to address this climate change impact across the world. There are about some 197, these countries which are part of this United Nations framework on climate change, and they are coming together, and this United Nations framework on climate change, they are, trying to make these policies, and they're trying to assess the climate change, and situations at the present level, and they're trying to give, these policies and actions for the countries, how they have to take the, the further actions, how, in which ways, in which mechanisms and tools and newer innovations and all, to reduce the green emissions and carbon footprints. So these are very important, mechanisms to address the climate change overall in the whole, world. Coming to the, this about the health part, because we are from the health sector, so as the climate change impacts the different sectors, this every other sectors like this agriculture, the whole ecosystems, in the forestry and all, transport, everything, So we are dealing more on the health, climate change, and impact on the health sector. And as we all know that, because of the this climate change, what we say is that there are rising temperatures are there, the others risk factors, in the form of this extreme weather events, rising sea level, as we have mentioned in the beginning, in the carbon dioxide level. All this created, this a lot of changes in the ecosystems in the form of this bacterial ecology, increasing allergens, water impacts are there, water and food supply impacts now, in terms of the nutrition, in terms of the types of food availability for the people, in terms of environmental degradations, and extreme heat, these all these things are the impacts for the from this climate change. Ultimately, the whole things, as you see in the author, this in this slide, these are all the this climate sensitive diseases or the health issues that we see in the beginning from the injuries or the fatalities or the deaths to the mental impact, the severe weather, to this cardiovascular disease or this cardio respiratory problems, like acute respiratory diseases in the forms of asthma, this asthma, and these cardiovascular diseases like this heart, all the heart problems, and we have also the vector issues in the forms of malaria. Then the issues is that say the vector ecologies this changed, and even in the these mountainous regions or in the regions in the country, where there were no vector issues, are having these issues of this. These are reported there, like in Uttarakhand, like in Himachal, where dengue were not reported. These are reported in the hill spots. Because of the changes in the temperature, the vectors, they begin to survive, they begin to breed out there, and they influences the health, this impact of there. So like that, others are, this water also, as we said about the, this climate change, is that it can impact the, this drought, and sometimes it can impact in the heavy rainfall and this flood. So all these water-related issues or the water, this impacted health issues, these are visible in the forms of cholera, in the forms of others, this foodborne, waterborne, this diseases. And these are the some of the, this we can say that these are snapshots, beginning from the climate change and weather change, then to the health impact. And this is about the mechanisms now, how the changes in the earth systems, like sea level, as we have been discussing, how this has impacted the, as we see in the last few years about the wildfires issues in the Amazon forest, in the Australian sites. These are a very big, deep, dense forest, which can really, trap the carbon dioxide from the from the air, from the atmosphere. And if this type of this, this sink for the carbon dioxide, these are lost, due to this wildfires, it can obviously, in two ways. There's one or two ways within the center here in the forest, because of the wildfires. There can be deaths of these millions of these organisms. So the ecosystem becomes disturbed. Another thing is that due to the wildfires, the sink for the carbon dioxide absorptions, these are also deeply badly impacted now. So the ultimately the climate change impacts are there, and ultimately it impacts the all sectors, including health sectors. And as we can see in the rightmost side, where we see the waterborne disease, vector-borne disease, nutritional, all this that we have been discussing in the last slide has been observed. This is another, this in the continuations of the health impact of the climate change, climate, yes, health impact of climate change. As you see here, the climate change is very much impacted on the left side, by the anthrop, these man-made causes. These are more of the, these are, giving about 80 to 90% natural causes to some extent, as we see here, the natural causes. This is as a lesser significant, more is from the more driving forces from the population dynamics and the unsustainable economic development. This is the beginning. This is the origins of this, this climate change, which we have been observing in the last, this 30, 40, 50 years, that we have been, accelerating in this present, this centuries. And we are thinking that in another 2030 and all, that the global warming will be such will reach to such an extent that it may have difficulty in bringing back to the this normal way of this life. So because of this climate change, the regional weather this can be impacted. Now all this that we have been discussed in the previous slide, and this this makes a really change in this this approximate causative factors for the health effects from this climate change. And ultimately, as we can see in the last part, is the temperature-related illness and death. This is what we call the heat-related illness or heat shock. Then we have the extreme weather-related illness, health illness effects, which are disaster-related issues, air pollution-related health effects, waterborne, water and foodborne. Then all these vector-borne and also these are the mechanisms that has been accepted now, how the climate change has impacted the health sector and the health of the people of the world and the country. So how are these addressed in the country? The next part will be this the Prime Minister's Council on Climate Change. Now this addresses the climate change issues in the country, and this Prime Minister Council on Climate Change. This was the this it comes into being in 2008, and they developed this National Action Plan on Climate Change. In that, they had 8 missions initially, in which the health was not there, but in its review in 2015 in January, the health was this. What to say? This they proposed this inclusions of the health missions on climate change, and after which then the National Action Plan was prepared under a this formulations of the technical expert group under the Ministry of Health and Family Welfare, and it became it was submitted in 2019 and 2021 after its updations to the Ministry of Environment, Forests and Climate Change, and it ultimately goes to the Prime Minister's office, which looks after the climate change issues in the country. And this national program on climate, and after this health mission, under this health mission on climate change, this national program on climate change and human health was developed, and it became approved in this 2019 February under the Ministry of Health and Family Welfare, and this will look after the concerns and supports of the state issues on this climate change, and particularly in relation to this health sector. Although the other sectors has been there since 2008, but the health was only inducted in approved for its inclusion in 2015, and after that ultimately in 2019 the national mission health missions on under the Ministry of Health and Family Welfare, they approved this program, and the states were supported for the activities, this program related activities implementation across the 36 states and UTs of the country. So the nodal ministries for the this climate change is the Ministry of Environment, Forest and Climate Change, and for the health missions on the climate change is the Ministry of Health and Family Welfare is nodal ministry, and National Center for Disease Control is the technical nodal agency to look after this the concerns of the health climate change and its impact in the health sector. And Center for Environmental and Occupational Health was developed in the National Center for Disease Control, and to look into this program. This is the institutional mechanisms, as I have been saying, that internationally or globally, United Nations Framework on Climate Change, on climate framework convention on climate change, it is looking up. They're assessing the climate change issues across the world, endemic policies and action plans. And for the and these are these are discussed and approved now with the countries now. What we call what it says that COP now, Conference of Parties now. And at present, COP26 is going to happen in England, Glasgow, no? And in this October and this November month, where they will be discussing about the climate change issues, no? Which has been which will be impacting the globally and the countries and when the countries which are known as these parties to the conventions, they will be participating into it. And under this one, we have this Prime Minister's Council on Climate Change. Then we have the Ministry of Environment, Forest, and this climate change. Under that, we have this Ministry of Health and Family Welfare. And after that, we have National Center for Disease Control, and then state level and district level. And at the this the central level, we have the this NCDC. At the same time, we have also have centers of excellence. There are about 18 centers of excellence which are of repute in the country, like this All India Institute of Medical Science, AIMS, New Delhi, PGM at Chandigarh. Then we have this NIMHANS from Bangalore. We have this NICET Kolkata. We have this these are all the institutes who will be looking after the subject specific. We call it climate sensitive health issues. We identify about 17 climate sensitive health issues across the country, and some of the this center of excellence they look after the some like hilly and mountainous these issues related on climate change and health, like NAGRIMS from Shillong, and JIPMAR is there, which looks after the coastal related these climate change health issues. They will be looking after that. And all these things we are trying to take the expertise from these reputed institutions and trying to develop this in health action plans, the subject specific health action plans on the climate sensitive issues. And they will be developing the standard operating procedures, which will give how to do the what we are intended to do to work out in that subject related area. Not only that, they will be developing guidelines, they will be developing IECs, they will be developing this surveillance mechanisms, and not only that, they will be helping the states now. They will be supporting states now, because states are also to have to make their state action plan on climate change and health, and there are chapters on that, and in that the centers of excellence will be hand holding them and in bringing up a more realistic this action plans for the states. These are the at the central component at the central level, and then we have this state level. In the state level, we have the three important institutional mechanisms. These are the state governing body, which will be led by the state health ministers, and the state level task force. These are multi-sectoral task force who will be who will be led by this principal secretary principal secretary health. And this will be membered by the this other different these departments from the forestry, from the animal husbandry, from the this agriculture, from the transport, from the weather department, pollution control board. We will be giving inputs to the this committee, state level, this task force committee. This in that they will develop this state action plan on climate change and human health, with the inputs or the data information available from these different departments. The health sector will be integrating all this information and data, and they will try to see what are the levels of the this vulnerability or the risk level in the state or the districts or the areas, and in terms of the resources available in the region or in the state, in the district, and they will make these action plans accordingly, how the resources in terms of these human resources, the giving training of these health professionals, and this community level health workers will be, in which areas that they will be trained in which these regions will be trained, in which type of this health professionals will be, required to train. All this they will identify during the time, and these action points will be coming up, and this will be implemented, for the state. And they're also helping the state environmental health cell, and the state environmental health cell will be under the state nodal officers now, and this will also be supported by the other departments now. Other departments will give the information to the state nodal officers, and there will be integrations of the, because as we all know that as we have already this discussing from the very beginning, that climate change impacts the air pollution, it impacts the heat, impacts the vector-borne diseases, it impacts the waterborne. So there are different national health programs now, and this vector-borne, these disease programs are there. There's waterborne. All this is will be, they will be implemented, they will be integrated, they will be, working in partnership. And below this, there will be this district level, and in the district level, this will be, under the leadership of this district magistrate or the DC, and it will be, supported by the either the CMO of the, this district, and there will be district level nodal officers for the climate change and human health, and he will be the, one who will be coordinating with all these the district level task force. This is one of the examples for the air pollution related, these illnesses or health issues. There's a comprehensive health action plan that has been developed recently under the, this National Program for Climate Change Human Health on air pollution and, and health related issues. And this, you can see that here also. And this is one of the examples of the, this climate sensitive health issue, and how it is going to be implemented. See, in the beginning, this the Prime Minister is there, as we have been, for the health mission on climate change has been doing. So there's a steering committee on health, on air pollution and health in the ministry. There is there, and under that, this National Center for Disease Control. And this is the technical agency, which is looking after one of the, this climate sensitive health issues. There are 17 climate sensitive health issues. And these will be, supported by 3 centers of excellence, like this BGMS Chandigarh, AIMS New Delhi, and the BPCS Institute. At the same time, there are two other centers of excellence, this TERI and this IIHMR, and they will be looking after the risks. They will be supporting the risks, and then in the vulnerability aspects of the, people in the health sector. And at the same time, this will also be supported by the ICMRs for contributing about this Indian evidence related in the air pollution and in the health aspects. And there are other partners from the international also, particularly WHO India, UNEP and World Bank. And WHO India, it's it is supporting fully to the program in implementing and policy formulations of the on air pollution and health. At the same time, this is also supported. This is also integrated with other national health programs like this NCDs, the NCDs related programs. And there are this integration or the partnering. What to say, that is mechanisms for interacting between these programs. How this can be, how this can be work out together. So these are the ways, the mechanisms now, and this will be interacting with the 36 states and duties, and at the this state level, they will be interacting with the medical, this colleges and tertiary hospitals, which will be helping in this developing these guidelines and training, the conduction of this training and all. And NGOs will also be supporting the others related this, these institutions will be helping and spreading out, giving this capacity building, ISC awareness campaigns, and the other health sector, this preparedness and response mechanisms. Like this, in the states, district level will be there, then block level, then PSC level will be monitored under the medical officers in the sub-centers, then at the village level in urban areas by the community level health worker. This is how the this ways of this reaching to the people or the communities is this is giving given the examples here. In the state level, the state governing body is very important. This is one of the institutional mechanisms under which they will take the state level these policies and all that challenges, and they will try to solve how the state will focus and prioritize the climate sensitive these issues, because every state in the country they have these different these climate sensitive health issues. When we say climate sensitive health issues, these are air pollution related illnesses, which is very much prevalent in the North Indian states of this Uttar Pradesh, this Haryana, then Delhi, then Punjab, then we have these non-attainment cities. There are around 132 of these non-attainment cities. And non-attainment cities in the sense that they are this the air quality level of the cities. These are very poor when they examine the data in the last three these years. So like that, in India, most of the cities, these are designated or identified as very polluted in terms of the air pollution. So the states and this governing bodies, they needs to this will be helping to prioritize now which type of this climate sensitive issues has to be given the priority. Some like in the this mountainous areas, they have in the present time having started having of the vector-borne issues, water-related issues. The other this severe weather event issues like in disasters and all. So ultimately this governing body has to take shape the states and union territories policies on the climate change and health aspect. Next comes the this state level multi-sectoral task force, and this multi-sectoral task force is very important, as we all know that climate change is impacting every every sector. And what happened here in the this health sector by this state level multi-sectoral task force is that health is going to get the has to get the inputs from the other sectors now, like from the agriculture sectors now. What is the what is the prevalent this crop types now, and what the nutritious content of the this the food available in the this area in the region, and how much this the state will be supported by the this agriculture sectors for the people. As we all know that food is very much related to the health of the people in terms of the malnutrition, in terms of the food foodborne illnesses, in terms of the the nutritional content, like in this micro this vitamin issues. And so with climate change, we believe that there are two main things that are happening. One is that the content of the this nutritional this amount is this reducing. It's not that has been seen in the last this 20-30 years before. This has been changing. Not only that, the type of this nutritionals, this has also been changed, and the type of crops, crop patterns are also changed. So all this leads to all this leads to having difficulty in the availability of the this adequate this food, at the same time this nutritious content of the food. So multi-sectoral task force will be I have just given one example of how the this this one of the department will be supporting the health sector. So the health sector has to take that actions and health action plan, how to deal with that, and how to supplement, how to bridge that gap. And that's the state level task force has to take upon the actions. So at the state level also, as I said, this is a mental health cell. This will be under the this state nodal officers. This is the political experts. and he will, and you know, they will be supported by all these others, you know, departments and the you know, this in the health sector also. There are other which are looking at the health issues, you know, health concerns, public health concerns. They will be supporting, you know, in terms, not only in terms of the, you know, this integrations of the health aspect schemes and all, but also about the capacity building from the, you know, state institutes of this training, and all this will be together, will be uh, part of the, you know, this environmental, you know, as a member of the environmental health cells, and they will be supporting this program in the state. So the roles and responsibilities of the, you know, ESC in state and UTs. As I said, this will be organizational structures, development of this state action plan and for this climate change and human health, giving this training and the capacity building, and you know, development of the surveillance mechanisms. Surveillance is one of the, you know, important aspects under the program, and this surveillance will be, you know, getting the information on the, you know, this prevalence of the, you know, occurrence of the you know, diseases, you know, the climate sensitive health issues in that districts or the, you know, this in districts or the, you know, states. So this will give an idea of about the, you know, the burden of the disease also, and this will help the, you know, this state policy makers in which way that resources will be, you know, this diverted or defocused. Not only that, no, we with the, you know, this environmental health sales will also be looking in other sectors, you know, like this development of the, you know, healthcare facilities. We say that, you know, as green and climate resilient. Green means that they're developing, you know, this environmentally friendly, you know, these measures in the forms of, you know, to reduce the, you know, this carbon emissions, you know, from the health sectors. Health sector is, you know, identified as one of the, you know, very you know, main contributors of these carbon emissions, and these carbon emissions, you know, this can, you know, lead to in this climate change. Yes, we all know that in the health sectors, these are working, you know, around the clock, 24/7. And as we know that, you know, there are many, you know, these tools and you know, these machines which are used in the health sectors. As you know that, yes, MRI, CT scans, you know, these are highly energy use utilized or intensive, you know, areas, you know, ICU, intensive care units, which works with many, you know, this equipments, you know, which uses, you know, this energy. So in order to make, you know, these health sectors or healthcare facilities, you know, green, and we need to, you know, we are developing mechanisms, you know, of taking up steps, you know, so that you know, from the health sector, the carbon emissions, these are lesser. This is one of the, you know, main area, or the only area which we say that from the health sector we contribute to the mitigation aspect of the climate change. Otherwise, you know, we in the, you know, from the health sector does only the adaptations, you know, these mechanisms, you know, to protect or prevent, you know, this control the climate sensitive health issues, you know, which are impacting to the people, you know, due to this climate change now. So these are some of the main, you know, let's say these roles and responsibilities from the environmental health cells now, which is very important and very critical for the for every state, and you know, and United Territories. And this they are going to develop this. Well, you know that the multi-sectoral task force, at the same time, this environmental health cells, they will be, you know, developing this state action plan on climate change and human health. Right now, we are having, you know, some states, you know, which has finalized them. You know, recently this Madhya Pradesh has published this Madhya Pradesh State Action Plan on Climate Change and Human Health. And you know, Kerala is also almost finalized on this Kerala State Action Plan on Climate Change and Human Health. And other states, these are also following. There are about, you know, other 28, you know, states, you know, which have drafted the, you know, State Action Plan on Climate Change and Human Health. Now, in this, you know, State Action Plan on Climate Change and Human Health, as you can see in the second part, you know, there's a mentioning of, you know, this climate sensitive, you know, diseases prevalent in the state. You know, this heat, vector-borne, water, foodborne, nutrition-related, allergic, these are all the mental health aspects, the genetics and the coastal areas, hilly and mountainous disaster issues. All these things, as you see here, how every these climate sensitive, health issues that we have, identified under the program, and the state has to, has to find out, what are the climate sensitive issues that is, mainly happening in the state, and accordingly they have to develop the action plans, for each of these, these climate sensitive health issues, because every climate sensitive health issues, this has, different, causative factors and different, ways to approach, for the management of the, this management of these health aspects. As you see, heat related, it is very much different from the vector borne. So like that, the state has to develop, and as a state action plan. Not only the state action plan, it has to, this district also has to develop the district action plan, because in the state, as you know, that in the state of this Rajasthan itself, not all districts, these are, this desert. The western part, this, and these are more of the desert. The other part, this are not fully. So every district has its own, issues, health issues, in terms of the climate change. So, the progress as of now, is that we all, in all the 36 states and the UTs in the country, we have identified the state nodal officers for the climate change, and human health. And these are the, these are the designated, this state nodal officer who will focus on the program. And we have another, 22 states which have already, they developed the environmental health cells. We have 23 states now which have already developed this multi-sectoral task force under Secretary Health of the state. Because, the program got approved in 2019, this February, and because of the pandemic, COVID pandemic, so things has been, there has been, challenges, in fully, functioning or fully, implementing the program. In the states also. So 23 states have developed this multi-sectoral task force. 21 states have already developed government bodies under the health ministers of the state, and 28 states, as I said in the beginning, that they have developed the state action plan on climate change and human health. And out of the 36 states and UTs, we have 21 states which have also identified in district nodal officers, and and other states are also following, that whole 36 states, and they are developing, and they're reporting, and they are, communicating to us that they have, already developed this district nodal officers and district level task force also. And one of the very important, area is the centers of excellence. Now, as we said in the very beginning, this is the 17 identified in a subject specific climate sensitive health issues. And as we begin from this vector-borne disease, every aspect it is there, occupational health, nutrition related, cardiopulmonary, all these things are there. So this whole 17, these are identified as the this climate sensitive health issues, and for each of these centers of excellence, these are identified. We still believe that they have the this expertise, and they have the that they can give the this output, or the the developments or support the this national action plan on climate change and health, and they can support the states in development of these climate sensitive health issues for the states also, in giving this IC development, and in giving the this training modules for the capacity buildings in all these areas. Some of the key objectives that we have under the programs, these are the awareness generations, capacity building for the health professionals and the community level workers, at the same time of the policymakers and all the other these key these stakeholders. And we have the research and development in terms of the evidence for the Indian evidence, because we are lacking this Indian evidence. So we are partnering with the ICMR, particularly because ICMR is the it is the authority. It has the authority for conducting this research related health related research issues in the country. So under the this ICMR, we are this coordinating on this subject issues that are having issues or gaps for the Indian evidence, and we're trying to conduct on that. The other fourth part is the health sector response preparedness at the same time some responses. This is another part which is very much a critical part because this will be the one which will be ultimately giving the what is the management of this for the preventions, for the protections, and for the control of the health issues of the people, particularly the vulnerable populations in the country. And obviously the last part will be about the partnerships or collaborations in the key this ministries and departments and international partners and NGOs from the country, and at the same time from the intra department which are working for the national health program of the country also, like NCDC. So some of the areas that we are working in that, these key objectives are that we give seasonal advisories for the heat and this air polluted, this illnesses concerns to the states. And every year, there is, this advisories. These are shared with the states and the UTS, 36 states and UTS, to help protect, this prevent and control these health issues. IC campaigns on climate sensitive diseases, particularly this air pollution and heat, at the present time, at the present moment, now we're expanding to the other issues like these vectors also, and waterborne, and there is national type workshop. This occurs also, and in the this World Environment Day in June, and there's also in September there's the International Day of Clean Air for Blue Skies are there. All these environmental health issues related. These international days on these days, there's a campaign. There's in the states, and not only that, there is also national webinar, and inviting these panelists or the experts in the subject related in areas, and we develop this training modules. In the recent times, we have shared to the states on training modules on this air pollution and its health impact, particularly for the women and children, and also recently we also did for the municipality workers and for the daily traffic police personnel. We believe that women and children these are very vulnerable to the this air pollution related issues. And also reaching to the this very important this vulnerable sectors, and if we can reach out to the mother, and you can reach out to the children can be safe for the coming generations, because the children has to go for long decades, years of this survivals and existence. So reaching to them, understanding them about the impacts of health impacts of this air pollution, and will be fruitful that we we believe that, and we all know that air pollution is one of the biggest environmental threat to human health. And so like this we do the this campaign for the health issues which are related to the climate change on this important international environmental health issues days. The others like capacity building. In the capacity building, we target for the health professionals and community level health workers. Community health level workers, as we know, they are the ones who are the doorstep health providers in the country. And the community level health workers are like this ASAs and these Anganwadi workers who have a direct touch to the these communities or the village levels, even in the urban ASAs also there. So giving this capacity training to them, reaching the intended or desired this info this say information system for strengthening the health of the health concerns for this vulnerable group of populations like these women and children. These are we feel that is critical. We also do for the state level officers and for the district level officers on the this overall this climate change concerns or the health issues under the program and we have done one after another, and we have almost covered all that. And we also develop these training models and other handbooks like infographic handbooks so that that infographic handbooks will be able to give an instantaneous this understandings of the health issues due to climate change. Particularly we have developed in these air pollutions, and this will be coming uh, in the later this slide it will be coming. There is the infographics for the health professionals on these air pollutions and health issues. And another concerns that we do is that this there are 6 councils which are related to medicals and the other nursing, and this medical and allied this these councils. These are the Medical Council of India, which we know. And then we have the National Board of Examination, Dental Council of India, Nursing Council of India, then Central Council of Homeopathy, and the Central Council of Indian Medicine. These are the 6 councils now, in which, if we believe that the program, the issues, the health issues due to climate change, particularly these air pollutions and this heat and other these climate sensitive issues, these are formalized and inducted into the this curriculum, this medical curriculum or dental curriculum, and this will be giving the capacity building of the students or the medical community in the allied this sectors. This will ultimately be helping the in the what to say, addressing the issues of the because they will be the real implementers on the ground in the in the coming in the next generation. So these are the strike or the target areas. We consider that this will be impacting the program in the country. And we also do review workshop with the state program officers, in which we see what are the implementations and level or the activities that they have undertaken in terms of the that we prioritize in the country, we prioritize in the states, and in terms of the this budgets from the national health missions that they have taken for this implementing the activities in the states. So these reviews are being undertaken every 3 month, 3 monthly. So like that, we try to see if things are in having gaps. Then we try to see what are the issues and problems. Then we try to support that areas for the states also. The third point is about the coordinations with the ICMR, as I have already mentioned in the last slide. They will be taking about the Indian, they will be giving the information on the Indian related evidence on the climate sensitive issues, and this will help the policy making. We are having with the partnership with the Ministry of Environment, Forest and Climate Change for the environmental health profile, and these are almost done. And there are other these campaign informations with the these experts under the Ministry of Health and Family Welfare, and they've compiled this air pollution compendium, and this has given the compilations of the data and evidence from the country, and this has really helped for the policy formulations in the under the program also. These are about the health sector preparedness. Here we say that about this centers of excellence, which will be supporting for the specific health addressing plans, development surveillance, vulnerability assessment for understanding the burden of diseases, and development of the climate resilience, and the collaborative partnership from the ministries, from the, we developed this high-level interministerial level committee with the Secretary Health and the Secretary Environment, and a joint working group is proposed to be set up on this agenda, this environment and health. And we are also focusing on climate and health specific inputs through collaboration with other national programs and with other, these institutions like national disaster management authorities, because they are working in the disaster related areas. And under this national program for climate change and health, we know that because of the climate change, extreme weather events are there which can collapse the health sector, healthcare infrastructures, which are very important during the time of these disasters. And development for resilience of this, this health sector for climate resilience is very much of a priority. This, as I said, this climate resilient and the green healthcare facility infrastructures. This is a priority, another priority concerns for the program. When you say climate resilient healthcare infrastructures, we say that healthcare facilities to be resilient should be able to cope or minimize the failure in the functioning of the this functioning and the structure of the infrastructure of the the healthcare facilities when severe this weather events like the storms or the these cyclones comes like in the West Bengal, like in this Orissa, like in Andhra Pradesh, in the western states of this Maharashtra and all. So there should be, we are thinking that this healthcare facility is very much important, because as the climate change is occurring, we said that the magnitude and frequency of these events, which can collapse the healthcare infrastructures, these are very much increasing in terms of the magnitude, means the size of the impact that it can affect, and the number of that that hazard or the extreme weather event occurring in a year. As we know that in the last 2-3 years now, this in the state of Kerala there has been happening of this heavy rainfall. There's because of that the floods are happening, and then it's impacting the health sector also. It's impacting the other sectors, health sectors also, and it affects the health and the people, in terms of the deaths, in terms of the morbidity, injuries and all. So because of that only, we consider that climate resilient, healthcare infrastructure development. This is of also prime importance. And the other part is the green in healthcare facilities development. This is about, as I said, about the reduction of the carbon emissions from the health sector by taking up the this renewable source of energy in terms of solar, like the solarization, solar panels. Taking up of energy efficient measures like LED. And then we also consider for this reduction of this transportations through diesels or and about the water conservation mechanisms now, like rainwater harvesting, like taking up measures like the faucets, we call faucets now, that the water outlet and where the water comes out from the tap, it's reduced now. There are sensors, either it can replace the sensors or it can replace the aerator, So like that, the mechanisms, water mechanism control, conservation mechanisms, or like this, this gray water, this mechanisms, gray water in the form that the water which is used up, this can be used for other, flushing mechanisms or for the, this gardening mechanisms or plantation mechanisms. These are the mechanisms, these are the measures that we also plan for the health sector, healthcare infrastructures also. And with all these things, this will be helping for the mitigations and at the same time adaptations to the changing this climate change. This is one of the example for the green in this healthcare facility. Here you can see solar panels are using, you can see, the grass here, you can see all this, and these are all the whole mechanisms. Roof is having, this rainwater pipes are here, roof garden is there, this will be, helping in the heat, heat aspect, the heat, heat will be, this will be affected, but because of this roof garden, on this painting of this, this roof, this can reflect or absorb, and this will not, let the heat enter the building, and the ultimate effect is that the building will not be heated up. At the same time, the energy use up in the healthcare facilities will be reduced also. So this is a total mechanisms now through which the, these healthcare facilities will be acting as a green building model now. So in order to do this one, the program has, has been partnering or, working with the NSSRC. NSSRC is the one which develops the standards for the, the IPSS guidelines, Indian Public Health Standards, which are used for the public healthcare facilities, including PSC, sub-care, the sub-centers, then the community health centers, up to the, this district hospitals. They develop the standards or the guidelines. So we are proposing what are the principles and for this adoption of this green and climate resilient, green or the environmentally friendly and the climate resilient, these principles. All these principles, if it is adopted, or if it is, if some of them these are also applied or imbibed in the, this all healthcare facilities across the country, this will be helping in the mitigations and adaptations from the Indian health sector. So there is, as I said, we have the training mechanisms now for the health impacts of the climate change for healthcare professionals, and for which we have been, working together with the NSSRC, and we have been, having discussion with the National Institute of Health Family Welfare, and we have been, working with the Centers of Excellence. Centers of Excellence will be, developing these training models also. So there are many stakeholders now. There are, these experts now who will be, helping on this, development of these training modules, and ultimately conduction of this training, this for the health professionals, including the state and nodal officers, district nodal officers, and development of TOTs in the states, and and for the community level health workers. All this will be, these are under the program, and this has been and doing, in one after another. These are some of the examples that I would say that under the programs, the training models, these were being developed, like the National Program on Climate Change and Human Health, for the community level training, or on air pollution and health for the children particularly, and for the women also. Here you can see for the women, here you can see for the children. These are the English version, and these are the Hindi version. So this will be, both can be used where the, where the Hindi is more prevalent, and where the, this English is also not prevalent. So the whole country can use up either both language. These are the, this health adaptation plan that we have developed now. One for the air pollution, another for the heat. At the present moment, we have finalized this, this adaptation, these plans, and others are also drafted, and others are also going to be, this finalized sooner. Then we have the, as I said, about the infographics now. This will be for the easier understandings of the issues now, for the health sector preparedness, or for air pollution, and another for the health professionals now. So these are pictographic, and this will easily, help the program officials. The others are that there is IC posters. IC posters like this, that we have developed under the program, and this There are various IAC, posters which are at the present moment we are developing more under this air pollution and heat, and we are expanding it to the other this climate sensitive and the general this climate sensitive climate change and the health impact aspect. As you can see here, these are developed under the Ministry of Health and Family Welfare, and this gives the information that this IC gives information that that air pollution can impact the whole these organ systems, and how we can protect from that, how we have to protect and how we have to prevent them, and under based on the understanding of the air quality level. And air quality level, as you know, this is available, and this is this is our standards which are developed from the Central Pollution Control, this board from the Ministry of Health, Ministry of Environment, Forest and this climate change. And another, this is also the same thing. These are available in the other IAC material. These are also available in the Hindi also, so that this can be used up by those in the Hindi speaking areas, and apart from them we have variety. I know that we have a range of this this IAC posters. Not only this, we have others also, and this is about the heat. Heat also we have developed with the help partnering with the under the Ministry of Health and Family Welfare, in partnering with the WHO and with the NCDC. This with this officers in the divisions. We have developed, and this has been sharing with the states from time to time, and before the onsets of this this heat related issues and the air pollution related issues. These are the other, as I said, the IAC posters that has been seen, that's in developed under the program. So all these things are the ways and mechanisms how we are to send the key messages now based on the the key objectives that we have on awareness program, awareness generation, capacity building, health sector preparedness and responses, then this collaboration or partnership, then or research in the Indian settings. All these are the five key these objectives for the program. So based on this, we try to work out, and we try to prioritize. We try to target the areas and in partnering with the centers of excellence, in partnering with the state nodal officers, state officials, district nodal officers, the health professional, community level health workers. All these are part of the whole this program, and we develop together, we work together, we campaign together, we we are all part of this this public health issues of national concerns. Now, to address these public health issues of national concern, this is the way forward that we have from other ministries, from other departments, from other international partners, from other national partners, and you know, uh, and striking and targeting the main key objectives. This is what we have from the program, and we are looking for more partnerships, more involvement from the people, from the from the other institutes, so that the the full implementations of the program and the full benefit of the program is achieved under the Ministry of Health and Family Welfare, Government of India. This is what the program aspires for. Thank you very much.